Welcome to the show, everybody. Today we are having a really important conversation with Teepa Snow. And Teepa Snow is a dementia care specialist who talks about positive approaches to care. Welcome to the show, Teepa.
Thanks. It's great to be here.
Well, we appreciate your time. And like Bridget and I, there are so many women in our demographic and men who are either caregivers or have a family member who's getting older and is starting to have cognitive issues. And I thought maybe we could start with the fact that dementia is an umbrella term because I don't think a lot of people realize that. Could you kind of explain what that term dementia means?
Yeah, so it's called a syndrome. It's a collection of symptoms that fit under the umbrella. In other words, your cognition is deteriorating. Something about how your brain is working, and it has to be at least two different areas or chunks of brain function that are starting to not just like you're having trouble with the words. I mean, you literally are losing some brain tissue now. Now, historically, it started off with some chemistry shifts and changes, but now it's getting into the nitty gritty of you're actually losing synaptic connections. You're losing brain cells. They're starting to fritz and then they start shrinking and then they start dying. And so the umbrella term means that you've got something that right now is affecting at least two parts of your brain. And as it progresses, it'll affect more. It is progressive. We don't have a way to stop it or turn it around right now, despite what people might read on the front page or the headlines. We might be able to slow in some cases for some dementias. We also know that it is going to get to where the person is no longer able to care for themselves. It will progress to a point of dependence on all things. And then it will get to a point where the brain can't run the body anymore. And so it's a terminal illness, which people don't tend to think about that much. But this starts off with just some thinking issues frequently, or language issues, or orientation to where I am issues, or ability to hold on to new information issues, or maybe visual issues. So under the umbrella, one of the big types of dementia is Alzheimer's. And that's too often what people think, well, dementia, Alzheimer's is all the same. It's like, no, there's over now, as of this year, recently, over 130 variations of dementia. And Alzheimer's has about six or seven of them in its bucket because not all Alzheimer's is the same. But then we have frontal temporal dementia, we have Lewy body dementia, we have vascular dementia, we have posterior cortical atrophy, we have, so I could go on and on. I mean, we have over 130 different variations. And so it's not just about memory problems. I mean, usually one area of dysfunction is your hippocampal area, which is for learning and memory wayfinding and keeping up with time.
Right. Yes.
So that
Uh,
that becomes an issue. That's one area for sure.
Right. I know I watched went on your website and I was watching some of your videos and I thought it was so interesting. You did talk about the parts of your brain that what goes first
Yeah.
was the last one to develop. Can you share a little bit
Yeah.
about that?
Yeah. Yeah. So you actually have now. So this is the tricky part. I'm going to see what y'all know about your brains. How many brains do you have up in your head? What do you think?
How
Well,
many brains?
brain,
Yeah.
I'm going to go with one.
one big
That's
brain.
what you would think. And
Yeah.
we'd be wrong because there's actually three distinct brains up there.
Really?
One is the one we think with, and that's called the cortical brain. And then underneath that is the primitive brain that keeps you going, whether you're awake or asleep. I mean, you don't have to think about swallowing, you just do it because it's part of the primitive brain function. You don't have to think about regulating your temperature, which when I notice, like you have hot flashes. That's that time when I have a hormone shifting going on in my body and my brain can't do it like it used to. It's like the estrogen isn't there. And so my brain can't do its job like it used to. So we often have brain fritzing at various points, adolescence, menopause, when we're really sick, things like that, we can have some fritzing. So our primitive brain is sometimes gets impaired, but it recovers, it heals, but not necessarily with dementia. And then the third brain is your cerebellum. which is the little brain tucked up underneath. And it's the brain you use when you're not thinking to do things. So if you started to cough, what would you do without thinking? What do you do when you start to cough? Cover your mouth. Yeah.
Yes.
And now two of you did two different things. I want to point that out. One of you brought your elbow up because you were trained in that school. Your hand, you came up in your hand, which is the old way of covering your mouth when you cough. So you have an older cerebellum than your partner. I mean, I don't know how to break that to you. You may not be older, but your cerebellum is older.
I am older, 6 months.
Well, see, yeah. And so that old habit that was instilled as a child stayed with you. And now you have it without thinking. And so what you're going to do is put your hand to your mouth. And that's like with COVID, it was like, don't do that. And there was a lot of tension around.
Right.
But what you have to do is you have to use your thinking brain to cut the cerebellum off and say, wait, no, you're not supposed to cough in your hand because then you might touch somebody or touch something. Okay, so what you want to do with the lobes of your brain called sensory motor is I need you to use your elbow. I need you to use your elbow. But you have to send that message from the prefrontal, the executive control, out here. And what triggered all that was the primitive brain doing something. And then you have vision, where I saw what happened, but you can't see yourself, so you didn't notice. And then I said something about it, which is my temporal lobes.
Wow, that's so much information. And to be fair, I too cough in my elbow. I just
I was a
Yeah,
teacher. We taught it.
well, no, really, honestly,
Yeah.
it started with COVID. You're right.
Yeah. And for me, it started
it
back
kind
when I
of
was teaching. Yeah.
yeah. See that for me, it was COVID, but before that, yes, I would cough.
You would have done. And so your brain sort of without thinking, when I said, what do you do when you cough? Your brain just went to the automatic. And
Right.
then when we talk about it, your brain goes, oh yeah, that's right. I'm supposed to do this. But it's still not like automatic for you. So there's hesitation. Now, my behavior around you makes a difference. So if I go, Colleen, we talked about this. I mean, why are you, I just told you, do not, how am I making you feel right then?
Like I did something wrong.
Tiny. Yeah.
And so, yeah, so your primitive brain doesn't like that. So when it sees me, guess what it already thinks?
You're going to be mean to me.
You're going to be mean. And so it's called anticipatory distress. So where people think people living with dementia can't learn new things, they do. What they learn frequently is you don't like me, I don't like you, what you're going to do is going to hurt, I don't like how you're being. And so I try to either avoid you or I argue with you because those are skills I keep.
Wow. Yeah.
That's so interesting. And it seems like with dementia, Bridget and I either, we have personal experiences, but also so many of our friends have family members with dementia, whatever category it would fall into. It seems like you kind of in the beginning make excuses. So it's not until they're a little further along that you actually say, okay, something here is wrong. And it's actually past the beginning stages. Can you talk a little bit about that?
Yeah, our society has such misperceptions about normal aging, typical aging. We tend to think, well, all people get like that. And it's like, no, they don't. Here's the challenge. By age 85, about half of us will have significant cognitive changes that are associated with dementia. So we went from 10% of us at age 55, 65, 10% to 50%. So during this wave of transition, there's a lot of desire for this to be normal. Because if what you're doing is not typical, not normal, not only is your life changing, so is mine. Everything about what I thought would happen when you got older and I got older and how we were going to spend our time, whether it's a spouse or a parent or a sibling, or even heaven forbid, it's a child with autism, with Down syndrome, with mental health issues, the risk is higher for that population. So those of us, I used to be in your group. Those of us in the middle generation, I'm moving into the upper group. Those of us in that middle group feel the pressure often of this noticing, but not really thinking. I mean, it's just when she gets, when she was tired, she was, well, that was just that one time. I mean, it doesn't happen very often. And that's true. The tricky part with dementia, it's progressive. And so at first, when we keep putting it off for aging, we miss lots of opportunities to choose something better for both of us. recognizing, wow, she didn't forget. She can't actually get it to latch into her hippocampus. So when she says, well, what time is my appointment? And you're like, Mom, I told you. Now, and that, ooh, there went that voice. And you want to go, so you're wanting to know what time the appointment is. You know what? Let's look. I think it might be on the calendar. Let's double check though. And I take her to the calendar and we look together, and then her brain sees it and she goes, oh, 2 o'clock. Yeah. Okay. Okay. So it's at 2 o'clock. Now, is that tomorrow? I said, well, today's Monday. And then I run my finger where on the calendar. She goes, oh, yeah, no, it's 2 days off. Wednesday. It's Wednesday. So it's not tomorrow. Oh, I thought it was tomorrow. Like, and what I'm noticing as a skilled practitioner, wow, not only did she not hang on to the data, she's a little getting lost in time. She's having more trouble keeping up with specific days, how far off, and she thinks she remembered. She actually didn't. Without the thing on the calendar, she couldn't remember. So guess how many more times she's going to ask you?
Yeah, that was
Many.
my question. Yeah, it's like it, and they're going to ask you that again and again and
Yeah.
again. Right.
And so we have to get so much better at, oh, you're wanting to know what time your appointment is. Tell you what, let's go look on the calendar. I think I might have put it on there. Now, my goal ultimately, maybe, is that she says, and I can say, you know what, it might be on the calendar. And then she can go to the calendar on her own a couple times after I've done it. But if she gets there and she goes, well, what's today? You might as well just make the trip. It's good exercise. You
Yeah.
have to pick and choose now. What are you going to do with it? It's like,
Right.
she actually needs me. It's
Yes.
not just the calendar. She actually needs me there to feel comfortable making sure she knows.
Right. And that's your pack, your positive approach to care, which is so important. I was reading this, and Colleen, we both have family members. I was reading it with my husband and was like, oh, I'm sending you this, I'm sending you this information. And it was so helpful because I know what he's going through with one of his parents, is so concerned about his finances. And my husband is really the most patient person, but he'll make, oh, a spreadsheet. Okay, I'll send it to you. Okay, I'll send it to you, because we don't live near him, but we go and
Long distance caring. Oh my heavens. That was super hard.
That
super
is. And fortunately, the spouse of this person is there to help. But what he's like, I thought I was going to make it easier by changing, like to make it bigger. Then that really scared, it really scared him. He was like, he, called, he still calls and was just like, I've made a terrible mistake. And it is,
They start to get hyper focused on things like their bank
yes,
accounts, their finances. Why is
control.
that?
It's about control, because that's super important. And I worked hard, and now, so there now, did I do the bills? I think I did the bills. How many times do you do the bills? Most of us, if we
once a
still
month.
do them by
Yeah.
hand.
Yeah. Yeah. You
Every
get your
month,
bill
right?
once a month. Yeah.
Yeah. So now it's like, was it this time or last time? I think I do them. I can't remember if I did them. Oh my God. And then they send you something that sort of looks like a bill. And that's what puts this current generation at high danger risk of people taking advantage of them with fraud and financial abuse, because people know to send something that looks like a bill overdue, sending to a collection agency. And this group currently talking about, man, they are like, I paid that. I swear I pay that. I must have. Oh my God, I owe them money. This is ridiculous. Oh, I better send it in, without thinking.
Right.
Or somebody
Right.
calls and says, somebody's trying to get in your account. Colleen, I hate to say this, but someone has been trying to get into your account. Now, I had your password. I think it was either a birthday or a dog name or something, but I'm not, it looks like they're trying to use that. Tell me what yours is so I can verify that what they're putting in is inaccurate.
Mhm.
Right.
Yeah.
And in that moment, if we still think somebody is typical aging,
Mhm.
We've totally missed the boat, and they're past that and into high risk zone because they're wrong.
Right. Right.
Right.
And they don't catch it. And so we find out after the fact, in about 80% of cases. There's already been a significant chunk of
Oh, yeah.
resources lost.
Oh, yeah.
With when you do start to notice that someone you know or love is starting to show signs of dementia, what can a person do? Because I know for me, it was like inventing the wheel. I didn't know where to go or what to do.
Yeah. One of the first steps to figure out is who should be the person to get curious. And it needs to be a curiosity, not an accusation. So I've got to figure out who in the team, who in the group is the best person to go, hey, Bridget, I wanted to check in with you. How have things been going for you? Super, okay, or not always so great anymore? What would you say?
Yeah. Oh, for me, for personally,
Yeah.
yeah.
And so, I
Oh,
mean,
me,
I
I'm great.
honestly,
Yeah, yeah, yeah,
yeah. So if the person says it's great and it's like, oh no,
yeah.
because then what I know is they don't have awareness of the things
Mhm.
that we're talking about. And somebody goes, well, I'm getting older. It's just hard to hold on to things. I mean, I think I'm slipping a little bit, but nothing, like nothing that people. So you notice something. So what kind of things? So, I mean, the first is to find out where are they? Are they somebody who's totally not aware? It's called anosognosia. It's a symptom of their dementia. Are they somewhat aware, but they don't think it's that much of a problem? Or are they totally aware and they're super anxious and they're nervous because they're afraid other people will notice? They're starting to withdraw from things. They're really upset with themselves. I can't figure out why I did that. That's ridiculous. I know better than that. Um, and so once we've recognized where are they, we want to look for resources for them and for us. I mean, we're going to need support. There's no doubt about it. This is not a rodeo to go to on your own. You want to go, okay, am I doing the buck and bronco, or am I riding the bull, or is this a barrel race, or what's going on here? Because we don't want to mess around with this. This is like, yeah, this is really hard having some changes and people saying, you need to not be driving. And I hate that for you, because it changes a lot, doesn't it?
Oh,
Yeah.
yeah. That was
Yeah,
that was
but
a tough
for
one.
right
Yeah.
now, I mean, for right now, the doctor's asking you not to drive right now. So let's talk about what we're going to do for right now. Who would you be okay driving if not you? I mean, I know it's uncomfortable. I hear you. This is just not okay. And then somebody might say, I want to fire him. Fire is, and it's like, whoa, well, cheesy Pete, where did that come from? Well, that came from a place of real distress. And so when we hear words, forbidden words that we didn't used to hear out of somebody's mouth in those situations, rather than going, Mom, what are you doing? Don't talk like that. You know better than that. What we want to do instead is go, wow, you're really mad at him. And just acknowledge the emotion that led to that and be a little bit, yeah, it's really hard to hear that. I hate it. I hate it for you. This is going to make it super hard for you because you've always been independent and it feels like somebody's trying to take something away. Yeah. And I can still drive. You've always been a good driver. It's called validation and reflection. You have always been a good driver. So it's hard when somebody says they don't want you driving right now. How many times have I said right now? Right now.
Yeah,
Right.
Right now.
Right.
that's good. Yeah.
So many people, I think, especially in our generation, want a diagnosis. They want to know what it is so that they can help.
Mhm.
But with 120 or 130 different forms of dementia, how do you get evaluated and how do you even know which one it is?
Yeah. So, I mean, there are people besides physicians who are pretty knowledgeable about dementia. And there are some physicians who are not at all knowledgeable about dementia, and one size fits all. And it's, what does it matter? And in some cases, it does. There are some types of dementia you really want to know. That's what I'm living with, because then I can make some best guesses is what I'm seeing is their dementia versus that's not part of their dementia. I think they have a UTI. You know what? I don't know that this is part of their dementia. I think they have an anxiety that's getting worse. I want to look at what's going on with the anxiety because she's always been a little anxious, but this is over the top. I mean, she's actually thinking people are coming in at night and taking things. It's like, okay, has that been a pattern? Nope. First time it happened. It's like, we need to look and see what else is going on here because something's stirring the pot. And I don't know that it's dementia. So I would say some of it also depends on your partner, the person who's living with dementia. Are they agreeable or are they fighting you tooth and nail? And if they're fighting tooth and nail, then I go to good resources and say, okay, well, the symptoms are consistent with this kind of dementia. I mean, you don't have to have a diagnosis to see symptoms and then go, okay, so we want to be super careful about this. Let's talk about what she does in the kitchen. Oh my God. I found ice cream in the closet. I mean, she's tried to use the microwave 2 times as the refrigerator. I find stuff in there. It's like, okay, so she really doesn't do a good job of knowing where things go anymore. I mean, when we're in that space, I would say, wow, how often do you notice that? I mean, this would be my evaluation. And you'd say, well, pretty often. I mean, I pretty much every grocery trip, it's like, okay, here's the good news, bad news. I don't think you're in the early state. I think this has been going on quite some time and it's escalating, it's getting more. So now you're going to have a lot to learn in a short window of time. And 80% of the time for family members, that's what happens. You're already in middle state dementia when you realize it in 80% of cases. And that's even if you brought it up to the doctor, they say, well, she's 82. What do you expect? It's like, expect her brain to work like it did when she was 81. And it's like, it's not doing that. So we should have a conversation a lot sooner than we thought,
When you have
2 to 5 years.
Right, your loved one, they've had this, physicians have set medications out, and the loved one is very resistant to the medications or anything to help. Is there, what are the advice there, for that
Or
situation?
what language can you use to make them more
Hey,
amenable?
Mom, I have a big favor to ask of you, and I know you're not going to like it. I already know that your preference would be not. So this is not about you. This is for me. I'm asking for a favor. I want us to try the medicine. I really want you to try it for 3 weeks. And if after 3 weeks you absolutely hate what it does to you, or it doesn't feel like it's doing anything for you, let's talk again. But I'm going to ask you for a big favor. This is not about you. And I know that. And that's what makes it super hard. You're doing me a huge favor. But I just want to see if there's anything we can do to make things a little better. And I get it that you'd rather just leave it alone.
Yeah.
Can we try?
And I think that's, I was just going to say, that's something you say throughout, I noticed throughout on your website, is the way you say things. You can, you talk about, don't be dishonest with them and the helping. Can you share a little bit of that advice?
Yeah, one of the tricky parts is we think we can sneak things by people. And unfortunately, when you get dementia, you don't get stupid, you get dementia. And the dementia means there are pieces missing, but it also means there are pieces present. And so you have to be further in a dementia to be able to slip medications in things and have somebody not notice. And people generally don't pick something good. If you do need to use medications for someone, I recommend strawberry jam because it has texture and it's super sweet. And so it hides a lot of the bitter, sour taste that might be in medicines. And if you have bits and pieces that didn't break apart, it still feels typical in their mouth. And so they swallow it without thinking about it. But for early on, I'd rather have someone work with me because if they find out I've been dishonest, if they catch me, and they might, now they can't trust me. And the tricky part for us is this is going to get more and more and more intimate. So if I don't trust somebody, how many of you think either one of you be interested in getting naked in front of me?
Yeah. Nope. No.
No, thank you.
No.
How about having you take a shower while I stand outside?
Right.
Yeah.
Right.
How about letting me buy food and make food for you and then have you eat it?
Yeah.
And so we build relationships over time built on trust and faith. But at the same time, I have to be careful how much I share. So I could say, ooh, would you come taste this for me? I'm really curious. See whether or not it seems like it's the recipe that you used to make. Because I try to make it that way. Taste it and see what you think. Rather than, Mom, you have not had anything to eat today. You're telling me you didn't eat. I mean, your food is still here on the plate from lunch. You've got to have something, which sounds like a demand. Or mom, you can't have any more. You already ate. What do you mean I already ate? I didn't eat anything. What are you talking about? This is the first time I've sat down. It's like, do you see that plate, that empty plate? That's a plate you were eating on. I mean, it's so tempting to use our reality to try to guide behavior. But if they're in a different space, I mean, she's not saying, I didn't eat today because she wants to be tricky. She's saying, I didn't eat today because there's a missing piece of her memory, which allows her to know she just got up from the table. She truly just got up from the table, went to the bathroom, brushed her hair, and she's back like she's ready to eat lunch. And it's like, wow, really not paying attention to the sensory cues in your body, are you? Whoa. Oh, hey, mom, before you eat, I have a big favor to ask of you. Could you help me? Come look at this for a second. This thing up here. Now, what do you think about that? Is that the kind of picture that would you want that hanging at your house or not? What do you think?
Oh, you want
Now,
us to answer?
Yeah, I mean, and so that's all it needs. Okay, now what happened to I need to eat right now?
Yeah.
Because you were full and you did have your satisfaction.
Oh, yeah, distracted.
What happened to it?
Yeah, that went away.
Distraction.
Yeah, because I actually attracted you to the picture. And so I try to get people to quit saying the word distraction and move to attraction. Because I actually need you to be attracted to something else so you'll let go of the thing you were holding on to.
Okay.
So
Wow.
it's a very different way of thinking about it. It's like, ooh, I want to show you something. And as soon as I say that, notice that your brain goes, yeah. Because
Right. Bridget and I both completely got attracted to the
You know,
picture.
it's so, it's very similar to when I was in education, when you worked with behavior of children. It's so similar from what I'm here. If you work
it's
with
because
behavior.
brains are brains, whether they're dying or whether they're developing. And so when I do this and I'm really interested in what happens to you,
we look at it. Yeah, we're there
attracted
too.
to it.
Yeah, yeah.
And then when if I put it right here and I say, now I'm wondering, you think we should try one of these or do you think we should just give it to somebody else? What do you think?
Yeah. I try one. I think we could try one. Yeah.
Now notice that I put it so that it's more towards you than I am.
Yes.
So what do you think somebody might do without thinking?
Just grab onto one of them.
Yep. And I say, yeah, let's see what's in there. And now all of a sudden I've got their hands and their eyes working together. I say, oh, tell you what, put it out on the plate and I'm ready for the next step and I'm ready for the next step. And all of a sudden, we're done with the task a little different than mom, you need to have something to eat. Come on, come on, come on.
Right.
It's like,
There's so much valuable information on your website, and we will have a link in the show notes for it. One of the things you talk about is hand over hand approach.
Or underhand.
And I think that was really
hand underhand.
Hand under
my
hand,
hand is under yours. Yeah.
Versus hand
it's
over
super
hand.
hard.
Yeah.
Yeah. So hand over hand, I learned that when I was an OT. We wrap our hand around the outside of the person's hand and try to get them to do something. And there's clinical evidence when you do that, they actually try to push back from you. So I thought, well, what if you use the palm of their hand? What if you take their hand and you put your hand under and then you manipulate the object, but they are holding onto your hand. They're holding onto your palm. And so their hand gets to feel what your hand is doing. And I've had people, no joke, we were doing the hand under hand. So I'm here supporting them and they're taking a drink and taking a drink. And then I say, here you go. And they take it and then they start drinking without me. Because once I cue them up, their brain goes, oh, I know how to do this. And then they just take over, which is huge because it means they are firing synapses in the sensory motor cortex that otherwise they're not. And so I can teach people to be more helpless, or I can keep people activated and being engaged. And that means if they're engaged in that, then they're less likely to be engaged in things I don't want them doing.
That's another one that you were talking about on one of the videos was at eye level or below eye level. And can you talk about that?
Yeah. So human beings take in a huge amount of visual data at any moment in time. Typically, however, we take in center field and then we take in peripheral. the edges. And we're really focused on the middle because that's where we have the best vision. But we notice things off to the side, like movement or color flashes or something happening over there. And when we notice it, we turn and we look. And now that's our center field. With dementia, I can only handle so much data. And so what happens is my occipital lobe, which is where vision is processed, I can only take it in. And so my visual field of what I can pay attention to, this is early, this is middle, this is late. Because I can only get one image to line up. If I try to do both, I either get double vision or blur. And so when I get to monocular, I have no depth perception. But it means if you are above me and I'm watching where I'm going, I don't even know you're there. But it means if I'm looking at you, I'm missing whatever I'm tripping over, which could be a step, it could be a dog, it could be the hassock. So really looking at the environment and going, okay, what is below knee level between one chair and the chair across the way in the living room? And what is above shoulder level that they might not notice that I need them to see, in which case I'm going to actually lower it down so it's where it should be. So I'll move important things out onto the counter or a low shelf on the refrigerator in the workspace, but I will move things I don't want people noticing as much up overhead. And that might mean an added deadbolt on the door with the key nearby, but up above head height. So that even if they undo the lock and get ready to go out at 3 a.m.,
yeah,
I have some extra time to go, what is that noise? What is she doing? Oh my God, she's going out. And I might also add an alarm so that it wakes me up. And then I know, oh boy, she thinks it's 7 a.m. It's only 2. She got up to go to the bathroom. She thought it was time to wake up, but she left her pajamas on and she's going outside and it's 32 degrees.
Right. For people who have a loved one recently diagnosed or unable to now live alone and they're coming to live with you, what are some of the best things that the caretaker can do to kind of set the space for the patient with dementia, the loved one?
Good idea. Good question. And the first answer I'd give you is prepare whoever's living with you.
Okay.
Because things are going to be very different than when people are visiting before. The second is look at the house they came from. Where's the bathroom from their bedroom? What do the steps look like? How's the lighting in the house? Where are things stored in the room they're going to be in? Is it to the same side of their body? Is it to the same direction of travel? Where are things that they typically look for? And you've known that they're starting to struggle. And for the first few weeks, I need to plan to be more around and less unavailable. But I also want to really be thoughtful about, oh, hey, mom, come with me. I want to show you something. So I'm actually doing a tour guide thing multiple times without it feeling like that. Now, oh, did you want coffee? Here you go. Look right here in this cabinet. And I might actually, if it's fairly early, put coffee cups at the bottom of the cabinet marker to say, oh, this is where coffee cups are. But later on, if somebody's actually a little further along, I might actually set her coffee cup out on the counter. So there's less hiding and seeking, which is what it might feel like. I may want to empty out the closet and just have a few things in there so that I'm not getting flustered and frustrated with unpacking the closet. And then I have to pack it back up. And then unpacking the closet or changing clothes, changing clothes, changing clothes, changing clothes, changing clothes to the point where you're like, I'm losing my mind. And it's like, oh, so before you make the invite, just make sure through what's my support system going to look like for when mom moves in, because, or dad, or my in-laws, or whatever it might be. It's a lot more to take on than you think it is when somebody's already shown some solid signs of change, because we put them in a new environment, and anything that was a little bit of an issue in the old environment can really become a major issue. So you want to be ready for the, hey, listen, I mean, it's been lovely staying with you, but I got to get home. I can't stay here anymore. And it's like, Mom, you remember, and this is that moment where you got to go, oh, so you're ready to go home. Oh, shoot, man, I had thought that you would stay for at least another day or so. Cause I mean, to be honest, I'm counting on you. So I better have some activities that I think would engage the person that I need them for. Because it's not at all uncommon. Right after I get there, I'm ready to go back home. But I wasn't doing well at home. That's why you made the choice to move me. But I think if I just get back to my place, I'll be fine. I'm not right. I'm wrong, but I think I'll be fine. So I'm going to push to go home. And so being prepared for that ahead of time makes all the difference in the world versus where you think, Mom, remember we talked this without thinking. You won't be thinking in that moment. You just go, Mom, no, remember you're staying here. Remember you moved up here? I never moved up. This is a vacation. I'm not going to stay. Why would I stay here? I've got the dog. And you're thinking, oh no, the dog's been dead for 2 years. What are you talking about? I mean, because again, in that moment, she's talking about having her life back, including where's the animal that made part of my life work, which I'm missing desperately, by the way.
Yeah.
Do you have a dog?
Yeah.
Yes, we have a dog, and
She
my
loves
dog is
that dog.
crazy about my mom. So
Yep.
Yeah.
Because now the dog has a job and Mom has a friend.
Yeah.
So
It's amazing. There's conversations with the loved one on my side of the family where the person's aware of what is happening and we'll have conversations and say, I'm never going in a home. I'm never doing this.
You're never wanting to go in a home. I hear you. That is going to
Yeah.
be one of the scariest thing that ever happened. You know what I think we should do though? I hear you saying you never want to do it. I'm going to ask you for a big favor. I want us to visit someplace because I want you to see what this place looks like. Because, the last time I went with you, you know where we went? To the nursing home. And I want you to take a look at what's out there. I mean, you may say the same thing. I'm not saying you won't, but I'd like us to check it out. Can I have a handshake on that we can try? I'm not saying anything about going. I just want you to go take a look at it because Mary lives there. And I want you to say hey to Mary. We can go visit her.
Yeah. That's been our tough thing is the one in our family is very stubborn. And
Yep.
even to get outside help, uh, any kind of what change, even when my husband and his siblings try to take turns to help just so the spouse can see her own children, it's
Yep.
very difficult. That will throw him off. It's a him. And it'll
Yep.
throw him off.
Yep.
And it's, we're really wanting to help her out. We're really wanting
Yep.
her to get some relief. And
Yep.
I know that bringing an outside person is going to really put him in a spin. Is there any
Yeah.
advice for that?
Yeah, there is. So okay, so I would say, say you are the spouse. Let's say Colleen is your spouse. Colleen, you're a spouse at the moment.
okay.
And I'm going to say, and you're the one with dementia. And I say, hey,
Okay.
Colleen, I have a huge favor to ask of you. I have this young guy, and he's really interested in broadcast kind of stuff. And I know you used to do like a podcast. I mean, didn't you do a podcast
Yes,
with
I
Bridget?
did.
I thought I remembered that. He would really like to learn about doing a podcast. If I brought him over, could you show him some of the ropes?
Sure, no
You
problem.
think? That would be super. Now I'm going to bring him over. I'll tell you something else. He really could use some fattening up. He's super skinny. So what if I brought him over at lunchtime? You guys could eat, and then he could show you about now I'm going to leave the sandwiches in the fridge. So maybe the two of you could get out the sandwiches and have lunch, and then you could show him the studio thing.
Okay.
Now, what did I take out of the arrangement?
That you need
That he's
help.
an aid.
That he's yeah.
There's no he's helping that person. It's simply he could use some help. He's looking to learn how to do something. And I pick an old skill that somebody has that they're still probably pretty good at, whatever it is. if it's science, history, whatever it might be about. And I say, I have a young guy or I have somebody that really is curious and I knew you'd be the person. And so we bring them in not as someone for helping, but for someone who's relationship building. And we involve some food if at all possible, so that we sit at a table and we chit chat a little bit and we get a chance to have stuff. Because men are more challenging often than women, because guys have to have something to talk about, because they're not big talkers. And so giving them something to focus on, maybe bring props, bring something, go somewhere. Oh, you know what? He really wants to see the barn. Oh, yeah. Well, the barn. Yeah, I could show him the barn.
Bridget, you could show them the barn.
Yes. Yeah. Wants to see
For-
your golf clubs.
For
Wants to
the,
see that.
the,
Yeah.
for the, we are adults, but we are children when it comes to
Yeah.
parents, doesn't matter their age.
Yep.
How do you deal? What suggestions do you have for?
Much better. That was so much better than how do you deal?
Yeah.
That was your first brain. That was that brain thing going.
But then your
"Ugh."
frontal
Didn't
lobe
like the
came
way
in.
that came out. Exactly.
That was smart how your brain picked up on that. I was like, that doesn't sound good. My mom wouldn't like that. Yeah, no, I shouldn't say it like that. That was good. And it was
She
good you
taught
were
me.
with me because I don't hold it against you. She might.
Yeah.
Exactly. She probably would. But what are some of the suggestions you would offer? Because I know for myself, it's like losing a piece of that person a little bit at a time. And I know for Bridget's husband, it's the same way. How do you, there's so many things happening at once. How do you kind of deal with that as well? What suggestions you have for people to deal with?
You will need a support person to grieve the loss. And what we make the mistake of doing is thinking, well, I mean, they're still there. I mean, it's not like I actually lost them. And it's like, no, you need somebody, either a support group that has part education, part support, or an individual who does both education and support. So you can learn, but you can also grieve and let go of the loss, because you are going to lose. I mean, sometimes it's momentary loss for a bit, and then it becomes a more transitional loss, and then it's gone. And so what we help people do is say, tell me what you still like about them. Tell me what they're still able to do. Let's look at what they can do. And then let's grieve what's missing, because we do want to grieve that. That's really different. And that was a key part of who your dad was to you. So it's really hard. So, one of my suggestions is maybe you aren't the one to talk about mom around dad if you've lost her, because that's too hard. He keeps losing that she's lost, she's gone. And he keeps talking about her like she's out having an affair or something. I mean, and those are real situations people have. It's like, why would mom ever have an affair? Well, she's not here, is she? And in that moment, you cannot, I don't care what kind of kid you are. I mean, you're like, it's going to be super hard not to say, Dad, the reason she isn't here is she died, come on, because in that moment it hurts so bad. It's not a safe space for you and him. And so someone else needs to pick up that brick and bring it forward. You're wondering where she is. And you're right. Not having her here is really hard. Did you need her for something? Or you're just missing her? Now I can do that because it's not my dad.
Right, exactly.
I can think it through. Why is he bringing up mom? What is it about mom and missing mom that all of a sudden came to the surface?
Right.
It's like, what in the heck? Where did this come from? And I can be curious because I'm not hurting so much. And I think it's really important to realize you are going to be losing things that you care a lot about. And it's like, ow. But I don't want to do that in front of the person. I want to go grieve my loss to the side and be present for them. And it's like, yeah, this is really hard. So the first time, if it happens, where I look at you and I go, no, you don't. Now are you from church or are you the grocery lady?
That's happened to
in
my
that
husband.
Yeah.
moment.
I can.
That's the moment where you have to go. So you're wanting to know if I'm from church or the grocery. You know what? I love church and I do go there, but I'm not knowing if I'm Teepa. And I'll just go, hey. And in that moment, they go, weird. My daughter's name is Teepa. And it's like, no joke, really. Is she a good daughter? She challenges.
Oh, so now you're trying to get inside information.
Get inside scoop, because my mother-in-law complained about me to me.
Oh, how
Oh,
funny. Oh,
yeah, my mother, she passed away 11 years ago, and just the very last year, dementia. And I'm one of 12 kids, and I would
Ooh.
stay with her. I'm number 11, and one of my sisters was her main caretaker, but I would give my sister a break and come over, and she took a nap, and she woke up and looked at me and said, "Do you have any brothers or sisters?" And I was just like, "Yeah, I do." And then my sister came home and said something to her about, she looked at me and said, "Did you know she is an only child?" And then my sister was like, "She's your daughter." And then she said, "Well, I wanted to know if you knew that," to my sister. Yeah,
aw.
it was, and
See,
it was fine. It was just fine. But there are
was that
issues.
moment of like, your sister embarrassed her a little bit. And it was like, well, I just wanted to know if you knew
Oh,
it.
and my mother was not the type to be like that. She would never be like,
Right.
"Oh, I know." So it is
Yeah.
very interesting. And you just have some really just such valuable information
Oh,
on
yes.
your website. And you do online as well. I know you're in North Carolina, but you
Yeah.
do online.
We have all kinds of stuff because, the pandemic got it to where you better be able to find it when you need it because you can't go anywhere. So
Wow.
we had stuff before, but after the pandemic, it's like, okay, we better figure out how to give people what they need when they need it because we're talking 24/7 all around the world. I mean, and the reason I know what I know is I made a lot of mistakes along the journey of 45 years of clinical practice. So, I mean, and
Right.
family members and friends and more family members and
It's
more friends.
so
We
important.
yeah, we
Yeah.
really we can't stress enough to our listeners who are going through this journey. Go on the website. Again, the links will be in the show notes because you have even just the gems of the
Oh,
brain
we
changes,
didn't even
6
get to
different
the gyms.
gems.
I was going through the gyms, and
I
I
know
was
Bridget and I were like, "Are you an Amber? Are you
yeah,
an"
this, yeah, yeah, try to
It
figure out the
opens up
Listen,
gyms.
conversations.
it
Right.
does. And every night you guys are beautiful pearls. And I am so glad you are because without sleep, you will not survive. And that pearl state is when you're inside yourself recovering. And
Right.
it's one of the things carers forget is take care of yourself. We need you there. And you're not second fiddle. You literally are essential. Literally.
Mhm. Yes.
Thank you for all you are
That
doing
is
You
in
are
this
welcome.
that
Thank
is
you for the
the good work.
opportunity.
The good work.
absolutely,
Yes.
and we can't wait to share this with our listeners because we know there's so many in our demographic that are starting to experience this with their parents or like you said a sibling or a
Yeah.
spouse or
Yeah.
God
Even
forbid
Or
even
child.
heaven
children.
forbid, but it happens
Right.
ourselves. And
Right.
recognizing,
Right.
I could use some help because peer support is essential. And reaching out when you think something's happening could be just age related, but it might not. And rather than let it go, get it checked out with somebody you trust, someone you trust.
One
Um,
one last question. Do you find that, when people are questioning whether it's just some memory loss because they're getting old, the personality changes seem to be that kind of what takes you over
Personality
the edge?
changes, yeah, or language shift. Like I can't, it's not people's names. I mean, yeah, people, we have trouble with names. It's, where we go to eat, um, shoot, it's right down there. They have the, it's like shoot, let me think. It's, hamburger. They have hamburgers there, but you don't get a hamburger. You get the other thing. With the, um, shoot, what's that? I mean, that kind of impairment in finding words, and I'm trying to work around them. That's pretty significant. That's not at all typical aging. Now, it could be anxiety and stress, or it's sleeplessness, or issues with having circulation problems in the brain, maybe diabetes, but it definitely should get sort of looked at a little bit more because that level of not being able to find the word restaurant, hamburger, um, chicken burger, I mean, whatever it was, I was not able to locate nouns. My nouns were missing. And I knew what I wanted to say. I knew exactly what I was talking about, but I couldn't find those words. That's one of those atypical dementia kind of first symptoms. And it can get misunderstood as, well, maybe she had a stroke, and there's no evidence I had a stroke. And so it's like, well, what's going on with her? oh, she's just really anxious. It's like, maybe, or
Mhm.
maybe it's the start of a
Uh,
primary progressive aphasia.
Thank you so much, Teepa Snow, for
You're
coming
welcome.
on.
Oh,
We
yes.
appreciate your time.